So first thing we're looking at are bones and joints. So to classify bones, we can have 5 types of bones. We can have a long bone, a short bone, a flat bone, an irregular bone, and a sesamoid bone. And each one of them is kind of classified by its shape and by its purpose. So first of all, a long bone is longer than they are wider. So an example would be the femur, your big leg bone. That's the longest bone in the body. It is longer than it is wider. But you also have other long bones in your legs, such as your tibia, and your fibula, which are the smaller bones below it. But you also get long bones in your ankle as well. So your metatarsals and your phalanges, so your toes and stuff, they're classed as long bones as well. The general purpose of a long bone is for leverage and movement. So you think if we move around on our legs, it gives us big leverage, so we can move as biomechanically as efficiently as possible. A short bone, therefore, is as long as it is wide. So they're normally cuboid in shape. And a good example is the carpals and the tarsals. So carpals are in your wrist, tarsals are in your ankle. And the benefit of these is that it gives lots of different surface areas. So imagine like a little dice in your wrist. You've got 9 carpals in your wrist, 9 little dice. That gives lots of different surface areas for muscles and tendons to attach to. So that's what gives us the dexterity. A flat bone is exactly what it says on the tin, it's flat. But they're generally there and designed for protection. So think of your cranium or your skull, that's a flat bone there to protect your brain. Your sternum at the front of your chest and your scapula at the back, your shoulder blades, are there to protect your vital organs, and your pelvis again is there to protect your reproductive organs, as well as they are also very good bones for muscles to attach to. An irregular bone means that they are irregular, and there's 33 of them in your body because you've got 33 vertebrae, so every single one of your vertebrae is a slightly different shape, and therefore it's classed as an irregular bone. And then the final one is what you call a sesamoid bone, and a sesamoid means seed-like, so it's a seed-like bone that's found within a tendon, and the example in your body is the patella or your kneecap will be classed as a sesamoid bone. And it gives your quad, as it travels over, as the patella tendon travels over the sesamoid bone and then into your tibia, or your tibial tuberosity, which is the insertion of your patella tendon. It gives it a little bit more leverage, so it helps you to fully extend your leg. So again, it's there for biomechanical reasons. So they're just the different classifications and purposes of the bones. Now just a quiz for you. So what type of bone is the following? So the phalanges, what type of bone is the phalanges? If you want to pause it quickly and write these down, you can do. But a phalange would be classed as a long bone, and your phalanges are like your fingers and your toes. What would your radius be classed as? So that would be a long bone as well. Radius in your ulna, in your arm. Your tarsals, so we mentioned them earlier. You can have tarsals and carpals. Tarsals are near your toes, carpals are in your wrist, and they'll be classed as short bones, as wide as they are long, so they're cuboid in shape. Your femur would be a long bone, longest bone in your body. The scapula, or your shoulder blade, that would be a flat bone, it's there for protection. Your kneecap, so you have 2 of these hopefully, would be a sesamoid bone, or your patella, a sesamoid bone. And then your vertebrae will be classed as an irregular bone, and there's 33 of them. So where bones meet, you'll have joints, and those joints will move in planes and axes. So a bit tricky to explain over a webinar, but hopefully you'll cover this in a workshop with a tutor. So your plane will be your sagittal, and you can have, we'll start that again. You have 3 planes. You have a sagittal plane, a frontal plane, and a transverse plane. So a good way to imagine these planes are, if you've got a piece of paper, or let's say a pane of glass as big as you, but very, very thin, like a window. If you were to use that pane and cut your body into left and right, so straight down the middle, that would be your sagittal plane. If you cut your body into front and back, so you're separating the back and the front of your body, so you almost stood in a pane of glass, and that would be your frontal plane. And then if you were to put a pane of glass through your trunk, so it's splitting your upper body from your lower body at your pelvis, that would be your transverse plane. And each plane is kind of associated with certain movements. So any flexion and extension movement would occur in the sagittal plane. So when you're squatting, lunging, deadlifting, bicep curling, doing a tricep extension, if you are lifting your arm in front of you like a front raise or returning it back, all of that is flexion and extension and occurs in the sagittal plane. Whereas if you're raising your arm to the side and then returning it, so you're doing like a lat raise, or you're doing like a lat pull down or a pull up, or you're raising your leg out to the side as well, that all of those happen in the frontal plane, and we'll be working the abduction or adduction movements. And then your transverse plane is associated with rotation. So if you're either looking left or right with your head, or you're actually rotating the whole of your trunk, then that would be occurring in the transverse plane. And just examples here, just go back one, sorry. So there, top left, someone's doing a bicep curl. The plane would be sagittal as she's be performing a flexion and extension movement. In the one below that, where she's performing a lunge, that would be a lunge in the sagittal plane of movement. In a sit-up, there's still flexion of the trunk, and therefore that would be occurring in the sagittal plane of movement. On the second photo, or the second column, where the lady's performing a lateral raise, that would be abduction, so working in the frontal plane. The gentleman doing the lateral flexion movement, so I'll just give you a second to think about that. Which way would they be moving there? So it's not flexion and extension, it's lateral flexion. So moving your body away from your body, essentially. That would be the frontal plane. There's then a machine at the bottom where he's doing a leg abduction, so that would be frontal again. And then the final one by itself is where the chap's rotating, so that being the transverse plane. So if you can try and align different planes with different movements, obviously in very large movements, let's say someone's playing tennis, you'll probably be using all of those planes at the same moment in time. Even, for example, when the lady's performing a lunge, she'll have to prevent her body from twisting, and therefore will still be using muscles to prevent rotation. So it's not that they're completely switched off, it's just we're focusing on one and trying to prevent it from another. So just while we're talking about movements and stuff, it's quite good to cover some terminology. So I'll just get these up so you can read through them, but I'll quickly go through them myself as well. So anterior is the front of your body. The posterior would be the back. So quite often people say you sit on your posterior, so your backside. Inferior in the human body generally means that it's something that is small or something that is below something else. So for example, your elbow is inferior to your shoulder, but also your shoulder is superior to your elbow because it's above. Lateral means the outside of your body, so when you do a lateral raise, or a lat raise people call it, it's because you're raising outside to the body. We could call that abduction, but it's a lateral movement to the outside of the body. Medial is the midline of your body, so if you bring your arm towards your body, you're bringing it towards the midline, which is the medial. And then if something is proximal to you, it means it's within your proximity or it's close. Or if something is distal, it means it's further away. So again, your elbow is distal to your shoulder, but your shoulder is proximal compared to your elbow, if that makes sense. So just some terminology to hopefully cover, because when we start talking about other anatomy and physiology in the other webinars, it might be quite useful to know them. So we just said where bones meet, you have joints. You can have different types of joints. So first of all, you can have a fibrous joint. A fibrous joint means they are generally, they don't move. So an example would be the plates in your skull. They are fused together because we don't want them to move. They're there mainly for protection, not for movement. Your cartilaginous joints are slightly movable. So we want them to move a little bit, but we don't want to give them too much mobility. And a good example would be your vertebrae in your spine. We want them to move a little bit, but not too much, otherwise there can be severe consequences. But the bones that we do want to move very freely are your synovial joints. And these synovial joints can then be broken down into further joints. So you can then see below, you've got a gliding joint, a pivot joint, a saddle joint, a ball and socket joint, an ellipsoid joint, and a hinge joint. So again, you've then got each one of these joints, you can have certain movements. So you can try and learn some of them together. So your hip and your shoulder are both ball and socket joints. Your hip, you can do 7 movements, and the shoulder, you can do 9. So if you can remember the 7 to begin with, you remember both of the movements for the hip and the shoulder, and then hopefully it's just a matter of remembering 2 more movements for the shoulder. Okay, so when you do this, if you hold your leg out in front of you, if you stand up and hold your leg out straight out in front of you, that would be hip flexion. If you do the same with your arm, so a straight arm, hold it out in front of you, that is flexion of your shoulder. So whether it's your leg straight out or your arm straight out, that is flexion of the hip or flexion of the shoulder. If you then slowly return that back to the start, you would be going through extension. Or if you keep moving and you start to pull your arm backwards or pull your leg backwards, that would be extension. If you pull your arm out to the side, you are taking your arm away from your body. If aliens were to take you away from the planet, you'd call that, they were abducting you. So if you take your arm away from your body, that's abduction. So that's to the side, not the front. If you do the same with your leg, take your leg away to the side, that is abduction. When you start to bring it back, so you're adding to your body, that's adduction, so adduction. If you do those 4 movements together, so you abduct your shoulder, you flex it, you adduct, and you extend, and you do it simultaneously, almost like a smooth pattern, then that's what you call circumduction. So it's flexion, adduction, abduction, and extension all performed together, but with no rotation. So no rotation occurs there. It's just those 4 movements together, almost like you're stirring something. When you do have rotation, you can have what you call lateral rotation. So if lateral is the outside of your body, if you hold your arm out, or to the side, and rotate your arm so it's, your thumb's moving outwards, that would be lateral rotation. If you then rotate your arm so it's then pointing inwards, that would be medial rotation. They can sometimes be referred to as external and internal rotation as well. Generally though, I would try and use lateral and medial as it's more anatomically correct. So they are the 7 movements of the hip, and the shoulder, but there's 2 more for the shoulder. So the last 2 for the shoulder are horizontal flexion and horizontal extension. So a good way to remember this is if you hold your arms out to the side as if you're in a crucifix position, there's a horizontal line going across your arms, and then when you clap your hands together, that's horizontal flexion, and when you separate and open them up, that will be horizontal extension. In your elbow and the knee, again there's some symmetry. You generally get flexion and extension. So if you do a bicep curl up, that will be flexion. As you lower that down, it's extension of the elbow. If you bend your knee, for want of a better word, that will be flexion. If you straighten your leg, that would be extension. The only little bit to know there is your knee can also rotate a little bit. We generally don't want it to rotate, but there is some movement for rotation, especially when the knee is flexed. So when the knee's bent, the knee can rotate a little bit. Obviously that's not always a good thing, as that's how people can damage the knees and twist the knees and damage the ligaments and stuff, but it is there for some variation in the movement. Your radial-ulnar joint is where your radius and your ulnar pass over each other, so it's near your elbow, it's just below your elbow joint, and that's classed as a pivot joint, and it's the movement that allows you to perform supination and pronation. So imagine if you were carrying a bowl of soup in front of you and the bowl was nestled in your hand, that would be supination, so you're carrying a bowl of soup. And then if you turn your hand over so it's palm down, that would be pronation. But that movement occurs just below the elbow joint, not at your wrist. So it is your radial and ulnar performing that, not your wrist. The movement that can occur at the wrist is flexion and extension. So if you have your hand out again in a supinated position, so the palm of your hand is up. If you try and flex your fingers and point them towards you, that would be flexion. If you try and then point them back and then down away from you, that would be extension. Plantar flexion and dorsiflexion. So plantar flexion is when you're pointing through your toes. So imagine you're doing a calf raise, that would be plantar flexion. And then dorsiflexion is when you're pointing your toes up. So plant is you're pointing your toes down, and dorsiflexion is you're pointing your toes up. Your shoulder girdle is different to your shoulder joint. So the 9 movements that we just went through there was all about the ball and socket joint. It's your humerus going into your scapula. Your shoulder girdle doesn't involve your humerus. So imagine if you had your arms pulled off, you had no arms anymore, you would still be able to perform the shoulder girdle movements because it doesn't involve the arm. It involves your collarbone, your shoulder blade, and your sternum. Or the more technical names would be your clavicle, your scapula, and your sternum. So it's those 3 bones that kind of slide and glide across each other. And the 4 movements are elevation. So if you shrug up, you're elevating. You know, you're lifting up your shoulder girdle. That's elevation. If you let them down, that would be depression. If you pull them forward to try and round your back off, that would be protraction. So pull for protraction. And if you pull them backwards, or imagine you're reversing, you're pulling them back, that would be retraction. So normally we want to keep them retracted and depressed a little bit, and that's quite good for our postures. If we let them protract, so come forward, rounding our back off, or we're kind of shrugging and we're quite tense, then that's normally quite bad for postures. And then in the spine and neck, you can have 4 movements. You can have flexion and an extension. So flexion is like doing your sit-up. An extension is like doing a back raise. Lateral flexion is where you're trying to kind of touch the side of your knee and you flex into the side. And rotation. One in your neck alone is what you call a pivot joint. So your atlas and axis, which is your C1 and your C2 of your vertebrae, which we will cover in a different webinar. Essentially your C1 is a disc and it sits on C2, which is like a peg, and that allows your first 2 cervical vertebrae, allows your head to look left and right, but you can also have rotation of your cervical vertebrae and your thoracic, and a little bit in your lumbar, but generally your lumbar doesn't want to rotate. We want to try and avoid that. So last one is we've just got your pelvic girdle. So your pelvic girdle is 3 bones, your ischium, your ilium, and your pubic bones. But quite often we refer to the pelvic as kind of one bone in itself, but you can have a left pelvis and a right pelvis, and each pelvis is made up of 3 bones. But we can, what you call an anterior tilt, so we can tilt it forwards, or we can tilt it backwards, and again that will then have an impact on our posture. So if we tilt it forwards, that normally gives us a bit of an inward curve in our lower back. If we try and tilt it backwards, that will give our lower back and make us round in our lower back.